Very good. I'm honored to be joined by elected officials from Northern Virginia and Suburban, Maryland, and Jackie Reyes, Director of the Latino Affairs in the District of Columbia, will be here momentarily. But before introducing them, I wanted to personally thank each of them for advising the Council of Governments and our partners as we plan this event today. The Honorable Walter Tejada is Vice Chairman of the Arlington County Board. He serves as a member of the Council of Governments Board of Directors, and he chairs our Human Services and Public Safety Policy Committee. Walter, in fact, helped put together the Council of Governments' first Latino Health Forum in 2013 and advocated for COG's partnership today for today's conference with George Washington University Avance Center and the Regional Primary Care Coalition. Honorable Nancy Navarro, District 4 Council Member of the Montgomery County Council, also serves on the Council of Governments Board of Directors, which I understand is the place to be in the region. As the first Latina member of the Montgomery County Council, she has worked to reduce inequities for Latinos both in her jurisdiction and throughout the region. I'll introduce Ms. Reyes, Director of the Mayor's Office on Latino Affairs in the District of Columbia. She's been instrumental in the development of programs that serve the community. She serves under Mayor Muriel Bowser and has been a strong advocate for the participation of Latino communities in the Latino community in the life of the district. So I'd like to bring Walter to the podium and Walter provide remarks. Following him will be Ms. Navarro and then Ms. Reyes, and then after that we'll have time for questions and dialogue. So without further ado, help me bring to the podium Walter Tejada.
Thank you, Chuck. Thank you very much, Chuck. Really excited to be here with my colleague, Nancy Navarro, who together we serve in the Metropolitan Washington Council of Governments Board of Directors in our respective jurisdictions, Montgomery County in her case, Arlington County in my case. So I am really thrilled to be here. Before I get started, I just want to thank those who took time to organize this event. As you know, for this kind of turnout, and we will be having we have a major program throughout the day, and those of you who are able to stick it out to the end of the day, how many people here like to party? Dance. How many people like to dance? All right, so if you want to engage in some of that activity, hang out to the end of the day, we have a reception that will celebrate our work today, because all work and no play is not fun, right? Plus, there's some drawings, so if everybody got a ticket, if you didn't get a ticket, make sure you get one, because it'll be a drawing for some good prices that will be, if we win. Can we keep it, Chuck? All right, just make sure. So I do want to single out a few folks that have worked really hard from the Metropolitan Washington Council of Governments perspective. You have staff from the Council of Governments here, Chuck.
Yes.
Please raise your hand, those of you who are COG staff, Council of Government staff, raise your hand. Don't be shy, come on, raise your hand up high so we can see you. Can we give them a warm hand, please? And it's always difficult to single out one person, right? Because it's a whole team effort. But I specifically want to single out Jenny Schitter, who worked really, really hard to put this together. Jenny, thank you for the work. Stand up so we can see you. Come on, who you are. There you go. Great. So indeed, as Chuck mentioned, in 2013, we took the first shot at creating this type of event to engage in a conversation that we know that there are health disparities out in the community, and we wanted to have an attempt. And that one was just with the Metropolitan Washington Council of Governments, but we are better when we unite and work as a team. So I'm delighted that we have folks that are joining our effort, especially with the Regional Primary Care Coalition, the Washington University, and I want to thank you very much. If I'm leaving someone out, I hope not. Please let me know, because it's important to mention the partners who work hard, and as well as the sponsors. We want to thank you so much for your partnering with us in this effort. But in any case, when we started a couple of years ago, we had, a pretty good turnout, but we had, as of yesterday, 297 people who have registered. So we cracked 300, I believe, since. And so I'm delighted that that is the case. And I would just make this pitch because I'm finishing up my term this year. I'm hoping that all of you will collectively push to make this happen again next year, so that please talk to those who are organizers from those organizations. There's a gentleman named Chuck Bean there, who's the Executive Director of the Council of Government. He needs to know so he can pass it on to his board of directors so they can make it happen. And I'm trusting Nancy will advocate down the line to make sure that we continue this. Because there might come a time where we might not need to do this because everything is great and we don't have any more health disparities or no barriers. But we know we're a long, long way from that to happen. So I'd just like to share some very quick information. And do I hit next? Do I hit the
Right arrow.
Okay, right arrow. There we go. Great. So I'd just like to share a little bit of Arlington from my perspective and some of the information that from the state of Virginia, so that we can have an idea, a snapshot of what it's like from the Virginia perspective. And I also want to say that I'm really thrilled to be in a facility that has 4 screens. So those of you way over there and those who are way over there, you still have a screen. You can see the information instead of squinting your eyes and see something that is on the screen. So thank you for watching Diversity for this facility. So in Arlington, it's actually the most densely populated county in the United States. We have over 8,000 people per square mile. And so I think the numbers are maybe a little off. We have 227,000 residents actually in our county. About 15%, actually it's 15.5% now, is Latino. And we do have we don't have necessarily some health disparities specifics in Arlington County, but believe me, there's quite a lot of barriers and behavioral risk factors that speak to the disparities in Virginia between the Latino population and the total population. So here you see some of that information that's come, some of it from the U.S. Census. And the next slide, this is what I really wanted to spend a little time on showing you, because in this slide you can see some key questions. Was there a time in the past 12 months when you needed to see a doctor but could not because of cost? And you can see as the first question here, you might not be able to read it, it's a little small print, but the answer for the Virginia population was yes, at 15.13%. For the Latino community, talk about disparities, 33%, almost 34% is the number. And the next question is, do you have any kind of health care coverage? For the total Virginia population is 15% said no. For the Latino community, a whopping 44.4%. We have barriers. We have a long way to go. And the next question about how long has it been since you last visited a doctor for a routine checkup? And in Virginia, 5 or more years ago, it was 7.1%. And for the Latino population, it's 8.7%. And the next question, do you have one person you think of as your personal doctor or a health care provider? And 23% in the general population said no, whereas 45% in the Latino population said they did not. So there's that barrier as well. And then between adults between 18 and 64 who have any kind of health care coverage, 18.4% in this entire population in Virginia said no, while in the Latino population specifically, 47%, almost half of the population. So we have a long way to go to improve. So, and finally, the uninsured population under 65 years of age, we see that in the general population in Virginia is 14% and more than double for the Latino community, over 30%. And what are some of the specific barriers that are encountered by the community? The lack of insurance is almost an obvious one, right? A lot of people don't have insurance, and I'll just make this my first pitch here on the Affordable Care Act. Virginia has refused, by and large, to implement the expansion of the Affordable Care Act, much to the detriment of the over 400,000 residents in Virginia who lack insurance. And the large majority of those folks who don't have insurance are located precisely where legislators live. And in the very same place they live, the very residents that they serve, they are actually denying that they have health care coverage. It's a shame. So those of you, how many people here from Virginia? Raise your hand. People from Virginia? All right. So, next time you can, please contact your state legislator or state delegate or state senator. Let them know it's a problem and we need to fix it. So a lack of access to healthcare providers, major problem. And there are some language and cultural barriers that are part of the problem. Even with the advent of the Affordable Care Act, not everyone has received coverage and were able to obtain it. And Virginia has not expanded Medicaid. So even for those with healthcare insurance, it is sometimes difficult to find a provider who has room in his or her practice for another patient. So without insurance, it's even hard to find a provider. And for those clinics that do serve the uninsured, they have so many patients that there's often a waiting list. How many people have heard about that? If someone comes in and complains, my God, it's a waiting list. It takes 15 years before I'm able to, or you make it, and some of us making a dental appointment, it's like 5-6 months or something like that. Sometimes, or some, so you can imagine folks who have less means and less understanding of the system. So without insurance, even hard to find a provider, as we say. Now, on top of that, imagine you have insurance. You have found a provider, but you don't speak English. And you don't understand even the basic expectations of how the healthcare system works. Now, I have to say that some of us who purport that we speak English, sometimes it's hard to understand the system. Can you imagine if you don't speak the language, whether it's Spanish or any other language? There are folks who are lost in the system. They don't understand how to navigate it. So even if you're at the facility and you cannot, and you can pay, you cannot understand the person at the front desk, and they cannot understand you, and all the other stuff that goes with it. So it is important then to have the vehicles like translators, and not just any translator, not just look around and grab the first person you see to translate. People who are expert translators and know the language of the medical world, that they know and understand the use of those terms, and not just grab someone that might be by chance. So finally, the overall community and social systems around us can create barriers that are sometimes not obvious, until they prevent you from being well, from fully engaging in the world around you, from getting health care or some other service that's needed. So these are what we call social detriments of health care. They include the circumstances all around us. As the Robert Wood Foundation put it, quote, health starts long before illness in our homes, schools, and jobs. Now, we in Arlington have, of course, pushed to expand the Affordable Care Act, and we have made it we have not minced any words and why it is important. So, we are in a different world, and we have also allocated some funds within our own county to assist and making sure people know what their options are. But things like where we live, or if even have a place to live, the lack of affordable housing is a big challenge, as we know, and as we learn. For some of you might be familiar with the 100 homes for 100 homeless individuals we did in Arlington. We were able to reach all of that as part of the 100,000 homes for 100,000 homeless individuals around the country. And so we were right there, and we exceeded it, actually. So we hope that everyone do their part. But this kind of thing also affects your health, and just having a stable place to call home can improve our health. And we take so many things for granted because we get to our apartments, our homes, we come in, we turn the key, and the door opens, we flip the light switch on, and we go about our business. We don't think any of it. Well, a lot of people don't have that benefit. And I know that here in the district and other places are in Maryland as well, we're making efforts to end homelessness. It's a tremendous work in progress, but it's something that everyone can help contribute to that. Now, we are working hard to break barriers in Arlington County and increase access to health and health care for all. The Robert Wood Johnson Foundation indicated, individuals and families must be empowered with the tools that allow them to make better choices. Here are some of the things we are doing and some of the success stories that we can share with other jurisdictions. And do let me know, Chuck, how much time I have so we can stay on time. Arlington County very much wants to see the Affordable Care Act succeed, in no small part because it will help to expand access to health insurance, basic. We have put resources into helping our residents apply for those benefits by being partners in the Certified Application Council program. So we've deliberately set out to do that. We have tried to increase access to health providers in the community organizations that provide care at low or no cost to clients. Many of them are from the Latino community. And also, we make sure to have bilingual staff on site. They include the Arlington Pediatric Center, the Arlington Free Clinic, Neighborhood Health, and Northern Virginia Dental Clinic, and many others. We share our dental operatory with dentists from both Arlington Free Clinic and Neighborhood Health from both Arlington and from Arlington Free Clinic. And this expands the number of dental appointments to those in need. And frankly, we have made recent efforts to reach way deep into the grassroots because there are a lot of people who don't go for dental checkups. Where we made sure, working with an organization called Virginia's Organized for Interfaith Community Engagement, to go even deeper into apartment complexes and engage folks with why it's important to they have dental coverage and dental checkups. So access to affordable transportation, another important reasons, including getting doctor's appointment, getting to the doctor's appointments and providing another partner called Thrive. And in Arlington, actually, you can live without owning a car. So you can save money by getting around in public transportation. We have 11 metro stations, a number of buses, our own bus lines in the county, in addition to the Washington Area Metro Transit Authority. And so those things have become very important. We started a bike share program. The district has expanded, now it's expanding in other jurisdictions as well. These are all really important elements that help us because frankly, if you're, I'm make a plug for the Capital Bike Shares here. If you're a member of it, if you use it for 29 minutes or less, it's free. So I don't know if you didn't know that, but if you didn't know that, start considering that. But you can get from one place to another. Sometimes it's the fastest way to get around in Washington, D.C. with all the traffic bumper to bumper. Mm-hmm. So to break down language and cultural barriers, to assure that we do not miss the changing needs of our diverse community, the Department of Human Services in Arlington County, in which public health is just one part, has a limited English proficiency committee that routinely reviews the language and cultural needs of our clients to assure that adjustments to increase language access are made as needed. So that is an important element because just having the AT&T line when someone just picks up the phone and dials something or you Google the translation, that's not going to cut it. Okay, we need to make sure we have professionals who can truly advise folks and make sure that instead of saying green, the translation should be red, and that's what we need to do and not have speculation. So all of our public health clinics have bilingual and bicultural staff. Now, I would challenge everyone's, wherever you live, in your jurisdiction, Maryland or Virginia or here in the district, should be our push, bicultural, bilingual. You don't need to, there are many people in this room who can be honorary Latinos. You don't necessarily have to be Latino, but please have the understanding of the cultural barriers or the cultural understanding, in addition to the language. So there are issues like the ones we call social determinants of health. And some quick examples. How much time do I have? 2 minutes, okay. No, it's good to stay on time. We got to stay on time because, we make sure Nancy gets her time and so does Jackie and all that. So I'll just touch on this one part because government needs to do their part. One of the things that I've been big about in Arlington, and as you see a little bit of my bio here, I did focus on health and fitness when it comes to our community. I established a program called Fit Arlington, where we are promoting a culture of fitness that the government needs to provide access to in the entire community where the facilities are to engage in healthy recreational activities, what type of nutrition you should have, because just saying that we want to be healthy is not good enough. We have to provide the connectivity, for instance, to sidewalks so you can have well-lighted streets, fields that are lit so that you can engage in whatever sports you want to play in or just throw the frisbee around, whatever the case is, so that make sure that those options are available for the community. And there are some other specific, perhaps during the question and answer segment, we can expand. But those things do not stop at the county or state lines. Local governments need to partner with one another, and I will submit to you that the Metropolitan Washington Council of Governments, which sometimes I describe as kind of the local governments United Nations, right? Because there are 22 governments that are part of the Council of Governments, and that includes all the major jurisdictions that are surrounding the Washington the District of Columbia, like Montgomery, Prince George's County, Virginia, Fairfax, Arlington, the City of Alexandria, and certainly, of course, the District of Columbia. So really, this is the place where we can perhaps look forward and pressure, advocate, so that the Council of Government continues to take the lead in making sure that we come together and local government can play a role on this defining health policy and health in all policies. So just want to end simply by, did this move? Didn't move. Did not move. Okay. Okay. We're stuck in that one, but I'll just end by saying that hopefully that this is not the last that we come together as a group. You are the frontline health providers. I know that many of you were students. You raised your hands at the beginning when you were asked. You are part of the key component down the line to advocate for making sure that everyone in our community has access and the barriers are reduced. I hope that someday we can eliminate those, but it really, those of us who advocate, it's really, we can do so much. It's also important for the younger generation who's coming ahead, especially many of you. Raise your hand, you see you either speak some Spanish or speak a lot of Spanish, and that's great because it turns out that when you learn Spanish, you can actually use it. I know that people take out languages in other countries, so when you come to the United States, speak English and you speak Spanish. Well, there may be other languages as well. So I will end now, and I look forward to your questions, but more than anything else, I look forward for your contributions in whatever role, capacity you have to make sure we break down these barriers and we work together as a region to improve the quality of health for everyone in our region. Thank you very much. Look forward
Thank you,
to your
Walter. Let's show our appreciation to Walter and also invite to the podium Nancy Navarro from Montgomery County.
Thank you very much. Okay. So my name is Nancy Navarro, and I am a District 4 council member in Montgomery County. I also served on the Montgomery County Board of Education for 4 years, and I'm a member of the COG's Board of Directors. And I just really wanted to thank everybody for participating today. The Avance Center, this partnership with George Washington University is so exciting, and I'm thrilled to learn even more about some of the projects that you are engaged in. I think it's so incredibly important. Also, big thank you to COG and Carlos Frijoles for their leadership on getting this going. And of course, the Honorable Tejada for really starting us off in this, what we hope to be an annual event. Thank you so much. So very quickly, I have some slides here, and I'll hopefully do a little bit of what Congresswoman Lujan Grisham was doing, which try to keep up with the notes as we tell the story here. But I wanted to highlight, of course, a little bit of a snapshot of Montgomery County as a whole for those of you who are not very familiar. Interesting to see the growth and the shift in population. As you can see, in 2014, we're a little bit over 1 million residents, the Latino population, and this is, of course, a bit underreported because we all understand the dynamics with the census, but roughly 192,887 residents. The share is 18.7%. Foreign-born population in Montgomery County, it's about 32%. And Latino students in MCPS, which I always say, it's a great way to see what's going on in the community at large. We see that already we have gone from 33,700 in 2000 to the 44,657. We all know that in the past 3 years, Latino kindergartners have outnumbered any other group of incoming students. So we know the trends, we understand the demographic shifts. And what's particularly interesting is that the ESOL students, 70% of our ESOL students are US born. They're majority Latino. So we have a dynamic in our county that is very interesting and I think sort of tracks and mirrors the nation. So we are a growing population in terms of the Latino community. I will say overall that in Maryland, in particular, in Montgomery County, the Latino community grew by 64% between 2000 and 2010. So just a little bit of a data point there. Montgomery County was ranked as the healthiest county in Maryland by the Robert Wood Johnson Foundation this year. So we're very excited about that, but we have a lot of work to do. That is for sure. In terms of barriers to health access for Latinos, you're going to hear, I think, quite a theme throughout our jurisdictions, and you've heard it with some of our presenters already. Even though I would like to point out that we have a lot of assets in the Latino community, given that there's a common language, given that we have very well-trained, experienced, and underutilized professionals in our county. We have a well-established Latino media at this point. We have influential Latino leaders that are out there doing work, a robust network of community-based entities. And I believe that the Latino community offers an untapped potential for community leadership. Nonetheless, we do have these barriers, right? The barriers around, the lack of health insurance, overall uninsured population. Montgomery County is about 60,000%. I didn't get the breakdown of that for Latinos, but it's a sizable number. The eligibility issues, the lack of understanding of eligibility requirements. I mean, that's definitely a big barrier for us. We know that Latinos point to the need for improved chronic disease prevention, treatment, and management. The whole prevention piece is a theme. And so we can only extrapolate that and understand that as the community continues to grow, and eventually as it ages, these issues around prevention and chronic disease management are going to become more and more of a burden to the overall healthcare system. We know that mixed status families, documented and undocumented, present a challenge and a barrier. We know that culturally and linguistically competent services are in high demand, and it is true. If you can learn Spanish, go for it, because it's definitely an asset. It's definitely a skill to have. Unavailability of adequate transportation, you heard that, for example, from Mr. Tejada, limited hours of operation, continuity of care, specialty care, and medications. So as I read those barriers, I'm reminded that as policymakers, we have to look at healthcare and disparities through the lens not just of healthcare, but also through the lens of all the policy decisions that we have to make. So when it comes to transportation, zoning issues, when it comes to academic achievement, so this academic achievement gap also has an impact on healthcare disparities, right? Almost everything we can think of, food deserts, working with, for example, farmers markets to bring fresher, more opportunities, more access to that type of food. So in reality, I think that it's important for policymakers to always connect all those dots so that when we are talking about social determinants and we're talking about outcomes, we're doing it in a comprehensive way. And I am a believer that that is how you start to really move the needle on some of these types of challenges. In terms of responses that Montgomery County has embarked in for quite a while, and it sort of predates, my joining the county council. Council president for this year is Councilmember George Leventhal, who really has pushed, as chair of our HHS committee, a lot of real significant structural changes in the county, and we've all coalesced around supporting that every single year. I have to say that I'm really proud to serve on a council that prioritizes funding for HHS, for these types of programs that I'm going to highlight for you. And that's really important because we all are going through difficult budget times, and it seems like it's always easy to target those programs that are for the most vulnerable, who are not the people that show up to testify all the time, right? So it's really important for policymakers to understand why you should protect all of these very important programs. Some of our responses have been the creation of Montgomery Cares. This is a public-private partnership, as you see here. In FY14, it served 28,011 patients through 12 community clinics with more than 30 sites. And we're talking about uninsured individuals. There is a copay according to what you earn. It's comprehensive. It's run by a lot of volunteers, a lot of professionals. It's really outstanding. And I visited those clinics, and the cultural competency around their service delivery model is just incredible. We have Care for Kids, as you see there. We have a Latino health initiative, and this is one way to constantly research and constantly engage in conversation about what could be best practices, what other trends out there, what should we look at. Very, very important. I would also like to, going back to Montgomery Cares and Care for Kids and maternity partnerships, most of those patients are in the areas of the county where we know we have concentration of poverty. So we're very aware of, again, of those social determinants and how can we continue to look at a holistic approach. We have school-based health and high school wellness centers. And I saw my colleague Luis Cardona standing over there, who you will hear from, I think, later on. This offers coordinated medical care, preventive services, positive youth development at 9 elementary schools and 3 high schools. And we have targeted them in those areas of the county where we know we have the most need. We also have some other programs like 311. This is a number that you can call if you have any kind of question with regards to government services. And we make sure that our HHS respondents are people who are also bilingual and bicultural. And I wanted to point out that, one of the issues that we started addressing last year during the summer was this notion that we were more and more experiencing an influx of children fleeing violence, right? And Montgomery County has definitely been one of the epicenters of recipients in terms of jurisdictions. And so we really quickly regrouped and created a coalition that Luis Cardona has also been a leader on. But that also implies that we have to take a peek at how do we deliver mental health services, how do we address trauma, how do we make sure that all these children are also having access to basic health care. So as you can see, all of these needs are fluid. There's never sort of a static set of issues that we have to deal with. It's constantly a fluid challenge. I think there was some conversation earlier about the need for stronger language access. Again, I think that language and competency continues to be a real deal. And for, I think, institutions of higher learning, this should be a priority. We never have enough therapists. We never have enough people who are bilingual and bicultural. And we're trying to explore, are there any ways that we can promote these types of partnerships? We do it with nurses so that local governments can partner with institutions of higher learning, offer internships and jobs to those who are bilingual and bicultural, because we need to grow sort of the brigade of professionals that can provide these services. It is so extraordinarily key. We interview a nurse that is originally from Venezuela. She came through a Welcome Back center that we have in Montgomery County. She now works in one of the major hospitals, Holy Cross. And it was interesting because she mentioned how when she first started working there, she said, everything was just like, hurry, hurry, hurry. It was like this tornado, and I didn't know where we were hurrying, but I was hurrying. But it was sort of speaking to the fact that for her in Venezuela, the delivery of care was pretty much like, señora, ¿cómo está usted esta mañana? ¿Cómo se siente? ¿Cómo está el primo? ¿Y qué le pasó? Se graduó el niño. Ay, qué bien. ¿Y se está sintiendo bien? Se tomó la hierbita el otro día. Okay, then we get to the bottom line. And she said, our community needs to learn that you have to go straight to the point because the doctor doesn't have any time to talk about your cousin or your aunt or anybody else. So it seems like a no-brainer, but, I deal with it, right? I mean, I go to the doctor and I'm like, what? It is true. It's like a tornado. The sense of efficiency is really important. And for many folks in the Latino community, it's like, what? I forgot, I have to write it down. I mean, all those things are really incredibly important in terms of cultural competency. Continuing on some of our programs, again, we have a leadership institute on equity and elimination of disparities, and I saw the director of HHS for Montgomery County is here, Umalualia. This is a very important institute, I think, for us also to explore best practices. And I also wanted to talk about some other legislative approaches that, believe it or not, have a big impact. I proposed, and the council adopted Bill 1414, requires county contractors to allow Health and Human Services employees to help their employees sign up for the Affordable Care Act, ACA, during work hours. Actually, it's to help employees of contractors that make what's called the living wage. And what was happening is that we had a strike of garbage, trash workers, 100% Latino, who told us we don't make enough money to buy health insurance, right? So now there's a law. You have to do it. Bill 1516 rewards those companies that actually offer already health care coverage to their employees, so that, Montgomery County, we say you offer it, good, you'll get a few points, so maybe that'll help you win a bid. And lastly, and this was why I look so tired today, yesterday we passed and adopted the strongest pesticide restriction measure in the United States. And guess what? My office was flooded with calls from the Latino community, from people calling the office in Spanish, ladies calling my office, moms saying, ¿qué voy a hacer ahora? Los niños no pueden jugar afuera porque los zancudos los van a picar y ustedes están restringiendo eso. So the pro-pesticide lobby was targeting the Latino community and scaring them and saying to them, oh my God, now you cannot even use insecticides or things like that. So we had to do a lot of work to explain to the Latino community exactly what was happening, but they were also using the workers, the landscaping workers, to come and say, please don't pass this bill, we're gonna lose our jobs. So it was interesting because as we were talking about environmental justice, there are issues like this, right, restricting pesticide use, that also has a major impact on health. Because those same workers who are the ones applying all this pesticide come home and they have families, they have children. So there's this effect that happens and that we have to educate our communities. So those were some of the examples. We are also, Montgomery County is the one who got the contract to be the Barron Health Benefit Exchange Connector Program. We also share conversations through the Center for Study of Social Policy, and this is more on the cross-jurisdictional collaboration. I spoke about the Children Fleeing Violence and the Welcome Back Center of Suburban, Maryland. These are ways that we can work together as jurisdictions, and I hope that opportunities like these that we continue to expand those through COG. This conversation about, what's happening in Virginia, what's happening in DC is really, really important. I think that we can collaborate on things like public engagement campaigns. I love that novela that was shown through the Adelante Center. I always feel I worry about these novelas sometimes because Montgomery County did a little one that was really kind of inappropriate. But anyway, I have 2 minutes. I mean, it was too stereotypical, okay? So I was like, oh my God, not another novela. But this one was great. And continue to support community entities working in cross-jurisdictional ways and facilitate meetings between, I think, our HHS directors and our councils to talk about broad themes. These are things that I would like to work on for sure, on top of everything else that we're trying to do. And I was very inspired by Congresswoman Juan Grisham because, oftentimes it's really hard to understand whether Congress even gets it. It looks like some of them do. And we will continue to do what we can on the local level. Really appreciate your time and your attention. I'm so excited to see so many young people here because some of us are getting to that age where we're about to pass the baton, and it's great that you're here and that you care about these issues. Thank you.
Thank you. It'll be time for questions for Councilmember Navarro in a moment, but let's welcome to the podium the Director of Latino Affairs for the District of Columbia, Jackie Reyes.
Buenos días. Okay. Buenos días, George Washington University, and thank you for having me here today. So my name is Jackie Reyes, and I'm the Director of the Mayor's Office on Latino Affairs, and Mayor Bowser sends her greetings. So that's what I do at the Mayor's Office. I represent her, and I represent the Latino community and the district, which we are 600,000 residents in the District of Columbia. And the Mayor's Office, what we do is, it was established in 1976, and it's the only, I'm very proud of this achievement that the Latino community had in 1976 to establish an office with a budget that advocates for the Latino community. So that's why we have we have a budget and a staff to go into the community to check what of the the things are falling out to the cracks, and we can go back to the government and say we need to fix things in what is in the level of and the government and change policies. And also we work very closely with our council, and I see Claudia Barahona here from Ward 1, or Ward 1 Councilwoman Brianna Doe. Gracias, Claudia, por estar acá. Okay, let me check, and I think we are. So, Office on Latino Affairs, we work very closely with our nonprofits. We have Mary Center. I don't know if we have Mary Center from here. People represented from a lot of nonprofits. Andromeda. These are the nonprofits that get funding through the Office on Latino Affairs. Clínica del Pueblo, they do a great job. It was established by a doctor fleeing El Salvador in the early 1980s. So we have good relationships with them, and we also fund these nonprofits. Catholic Charities, Vida Centers. We're always looking out for our seniors. Casa Ruby, we know we have a good, the LGBTQ Latino, we had an epidemic in the 80s that they were the HIV, so we needed to work with them. And we have also the SET Center that it was just established in the district. And we run the LGBTQ Latino Task Force, because we wanted to make sure that we know in the Latino community we have all the different cliques. So, as one in the Latino Task Force, what we do is we bring all the heads, because the main reason for us is to work with everyone. That's the only way we're gonna go ahead with in addressing the Latino agenda. But like I say, Washington, D.C., the nation's capital. Qué lindo, ¿verdad? The part of the diversity of our city is we are representing 130 countries, and the most of them we are the Latinos. We are the ones who have the most. And we have a breakdown. We just Office of Planning just released the breakdown in the different countries, which are the Salvadorians. We're at 30%. Can you hear me now? Okay. 30% Mexico, Guatemala, Puerto Rico, Cuba, and Dominican Republic. That's the breakdown of how the city looked like. So I will say, like, you know, if you see in DC, if you see 10 people, 8 of them will be Latino from I take pride. I came here in 1990, so DC was my hometown. Okay, vámonos. Okay, so how this breaks down. We have the Office of the Deputy Mayor of Health and Human Services, Ms. Donald, who has been great, and we have other agencies that's where all this funding comes from to tackle down the health in DC. And the mayor has a mantra that we are Washington, so there's not difference, and we are dividing 8 different districts, and she says everybody's here is equal, and we are giving services to all 8 wards. So that's what is the all Washington, and these are the departments that we work with. And as my level, as a cabinet level, and the office the mayor's office, I have access to the directors. And, you know, we have and I will talk about the different programs that we have. I have the access to go and talk to the director and say, we're having problems on Taylor Street. You know, there are people that speak the language, but they are from different countries that they are not relating to the population. And, you know, some terms that they don't get along, you know, they're not communicating well. The office, that's where we come in. And that's what we have been doing assessment for this past 7 months. So one of the programs that we have under the Department of Human Services is what is called the DC Healthy Families, which is provided also for undocumented. And this was something that it was passed by a DC council by the council member Graham and in the 2000s, because we have, and one of the things that we believe is that we know prevention, and it's cheaper in the front end to have and to take care of people doing prevention work instead of like a late sickness, you know. So that's why we have the DC Healthy Families that are undocumented, they have access to it, to the insurance program. Okay, so this will be one. We have that's the DC Hercal Alliance, and we also have the Refugee Services, and that is under the Department of Human Services also. Okay. The strong families. So we work very closely with all of the clinics and make sure that we are setting up programs for the people who are setting back into the community. So we have, you know, caseworkers, and it's a whole 9 yards of healthcare providers, and I believe that many of us are here in the room. So, but what is going on? We have all of these services, but we still have a breakdown. And, you know, and we say how we're going to break these barriers, right? Botando estos muros. So how we're going to do this. And because we do have a lot and one of the main things that we're dealing with, especially in the District of Columbia, it's cancer and many type of cancers. And what we do is, and that's what I believe so strong, to do a preventive checkups yearly. One of the leading causes in the district is we are at 23% in heart diseases. One of the things is like, well, how do we get ourselves healthy? Mayor Bowser has done also the challenge of the 1 million steps, and we do walks because we have to start somewhere, you know. And some of the thing is that we are losing our women. As a women, we take care of everybody except ourselves. You know, as a working moms, as single moms, We are like, we take our kids to the doctors, but we don't, sometimes, oh, we can't wait. Oh, it's late. Oh, I just gonna have to reschedule my appointment. So, and we are seeing our women suffering a lot for that. And HIV is still an issue. That's what we have to get more. HIV has been more, and what are we seeing is younger people are getting infected. Since the epidemic, it goes in olas, se van y se vienen, se van y se vienen. So the epidemic now is just like, okay, the younger people are like, oh, HIV is not an issue anymore. So they are not taking care of themselves. So that's why we see we see the increment also in HIV, especially in the young Latinos. And I see Ana Wilson here from the Clínica del Pueblo, gracias, that she brings all these things about language access. We don't have this, but I can say very proudly about DC. And some things that once we go out the bubble and we see what's going on in the country, Washington DC, we have the strongest laws on language access. So this was passed on 2003 when it's mandatory. It's the law. In Washington, the DC department agencies, the main ones like the DMV, DHS, we translate and interpreters. 2 minutes. Okay. Gracias. Okay. So interpreters are available. That we have to translate all of these main documents, but we're still on because people don't know. People don't know their rights. So what do we do as officials and as a practitioners to make sure that people knows about their rights? You have the right in the District of Columbia. You have the right to understand what is your diagnosis, and to fully understand. So when I see cases of people that they don't know and they were dying moms that they leave the children's on their own, it just hurt my and that's what I work 24/7. And I make my staff also, and I have Ingrid here. They know that I push them hard because if we lose somebody, that's a family that we're gonna get, and then all of this is cycle of people, that creates more poverty. And so that's what we have. We still have a big language gap of people speaking Spanish in our households. So language access is a good initiative. And that's how we're going to create a path to the middle class when we all are educated and our communities knows what are the services that we have going on here. This is some more graphics about the trends. And even though that we live in the nation's capital, we do have a big gap in poverty. And one of the big things with Mayor Bowser is how we're going to create that path to the middle class. And we're going to do that by getting support, getting these services that our community needs. In conclusion, with all of this, and I think I'm on that, how we're going to achieve all of this is working together. And and I applaud that we can come together and we can do best practices like my co-speakers here, our chairman Walter Tejada, and our councilwoman Nancy Navarro, which I applaud you for your leadership, and also in Montgomery County with the children. I know that we have a good advocate, Luis Cardona, and he won't let us off the break. So that's how we're going to achieve this, by working together. And I'll say something, how we're going to achieve this is breaking these barriers. And I will say tumbando los muros, Don't say that to Donald Trump, right? That he wants to build more muros. But, how we're going to do is when we get united, and one of the things is because if we succeed, all of our community is going to succeed, and we have to. That should be our goal. If I want to see another Latina, I'm going to push her up and push her to the good. We're not going to push them down. We're going to have to lift us up, and that's how I think we're going to achieve all of these gaps in health. If we are healthy, we're gonna live longer. That's the bottom line. Gracias.
Thank you, Director Reyes. And we're going to have a few minutes for questions here. I'd like to start, if I could. Okay. And I know there's this question about Medicaid eligibility and the differences between Virginia, DC, and Maryland. I know there's a lot of PhDs in the room, but if you could simplify it so I could explain it to my mother. Which jurisdictions have access to Medicaid, and what's the eligibility? If you could simplify it. Walter, you could just say no,
Well, let's start with Virginia. As you heard me talk already about the refusal to expand the Affordable Care Act in the state of Virginia, in the state of Virginia overall. Really comes down to a lot of people that are undocumented. Everyone's undocumented is not eligible to apply for Medicaid expansion or any. So in that regard, that leaves that huge segment of our population. Then you get mixed status families, many of them that the parent is the breadwinner in the house, and so you have sometimes children who may be at risk of not having the appropriate health care coverage that's needed.
Thank you.
So that's one area. I'm happy to expand more on that.
And in Maryland and DC, generally, yes. And you all have funded navigators for people to enter the system. But could you just talk a little bit about Medicaid eligibility, if you don't mind?
Well, I mean, I would not go into all the specifics of Medicaid eligibility. I would hope that Uma can do that. But what I can say is that, we definitely, obviously, are very strong when it comes to ACA. We believe in it. As a matter of fact, Montgomery County has the grant to be the connector for both Prince George's County and Montgomery County. And as you heard me say before, I passed a law so that low-income employees of county contractors would have to be signed on if they don't have health insurance. I think that the biggest challenge, as it was described by Mr. Tejada, is the fact that, yes, with mixed status families, that is a real concern. I think it was also pointed out, I don't remember if it was Congresswoman Lujan, with this issue of how, she's looking in Congress of how you can, even when people who are residents but then are not eligible, they have to wait 5 years to receive some of the benefits around health care and ACA. And so these are very important issues because it does speak to the fact that we're bifurcating access to health care depending on your status. And then even when you are in the process, it's as if we're making it more and more difficult and even more expensive. And the longer that people go without coverage, obviously, the more we're going to have challenges with chronic disease, et cetera. So, yeah.
Thank you.
So in DC also, because this is a federal money and we cannot use that money for Medicare or Medicaid or Medicare, but we do have what is called the DC Healthcare Alliance program, which some of these families we can provide healthcare for these families.
But Medicaid for some folks is available, just not for undocumented.
Yes.
Is that right?
Yeah.
Good. There might be more clarifications. If we could get a hand for somebody that wants to ask a question, and we'll bring a mic to you. And if you wouldn't mind just identifying yourself, particularly any questions that would be helpful for our collective learning that are maybe not just an axe to grind with one of these people up here. So, yes, bring the microphone here, please.
Good morning. My name is Kathy Awkard, and I'm a nursing skills lab instructor from Montgomery College. And one of the things that I heard this morning sort of alluded to this topic, but I would like the panelists to talk a little bit more about it. I'm convinced that part of the issue and the way that we deal with health equity and health disparities is to streamline the pipeline for education, particularly with regard to careers in health professions. So I would like to hear a little bit from the panelists about their thoughts on that topic and what initiatives might be in place that they know of in their jurisdictions. And I'd also like to ask the panelists to speak a little bit about health disparities related to behavioral health issues, because I haven't heard very much talk about that. And that is a significant issue, particularly with the population about which we are speaking today.
Person who's formerly led a school board, will you care to start us off on that?
Sure. So Montgomery College is a huge partner in how we try to address this issue of availability of professionals who are bilingual, bicultural, or are interested in working with these populations. I think I mentioned earlier the Suburban Welcome Back Center. That's one program that we have in Montgomery County. So if you have healthcare professionals, many times you have doctors that come from Latin American countries or Central American countries, and they would like to continue their profession. Many of them are working, taking care of children or things like that. So this is a process through which they can then be able to at least become RNs, and it's been very successful. We are also in partnership with Ana Jimenez University, which is a bilingual university that is located in Wheaton, also establishing those types of programs for nursing, which is really important. But definitely through this pipeline with Montgomery College, universities at Shady Grove, we're continuing to expand those types of services. So we're growing our own pipeline versus just sighing and complaining that we can't find professionals. That's one piece. The mental health piece is really, really critical. I think I touched on it just very briefly, especially with our children fleeing violence, but we see it across the board. And that is such a challenge for us because of that whole notion, again, of finding qualified bilingual, bicultural, or culturally competent practitioners. One incredible, I think, program that we funded and hopefully it'll get started very soon is a mobile mental health for children unit, and really looking at how do we use our partners in the community, our community organizations to raise the awareness of mental health provision. We have different organizations like the Commission for Women who have also provided culturally competent counseling services. So that is definitely, I think, a really, really concerning disparity that we must all work on as much as possible to do public awareness, but also to respond with the actual support.
Yeah, and yes, and this is one of the things that I emphasize a lot. Because we have all of these great initiatives, but sometimes we don't even know that those resources are in place, and we have to do a better job making sure that everybody knows. One of the things that I say, get all of that, you're on Facebook every day talking about nonsense. Get these things out there, make use of social media, of what's going on, and that's what I tell people. The more we know, the better that we're gonna save lives. And that's how critical it is. And one of the things that I do, and I do understand you touched one point, is substance abuse and rehabilitation programs. And we have a big problem in the Latino community. People, we closed down, and that was one of the setbacks. I had to take a lot of losses, and and then you just feel a punch in your stomach. They closed this lower barrier shelter in La Casa. That many Latinos came over there, and then I struggled to keep Hermano Pedro at the church, but I couldn't. We couldn't get the support around it. But most of our men have an alcohol problem, and we don't have that rehabilitation. We don't have that detox for them. They send them to Howard University, and then they get detox for 2 days. And believe me, one of the things is, and I see Yvonne here doing research. We need to get more of that. Or what is the trends with our men? Most of and I do believe that we have to get more programs for rehabilitation and substance abuse.
Chuck, yeah, I'm going to touch on briefly on this. You raised a couple of really important points. There are some basic steps that can be taken for streamlining education and the opportunities, and it needs to be taken as a whole, involvement of family and the community at large. We have a school in Arlington called the Carlin Springs School, for example. It's a community monitoring school fully with bilingual staff, and there's a health clinic that has bilingual staff. And there are many other multiple services and programs that assist families. Like sometimes when there are after-school activities, you have the parents are invited to also participate. And there's a component of some of their interaction is together. And there's been a couple of pilot programs that we launched to see can families interact and engage in healthy recreational habits, not only in nutrition, but some interaction among themselves. And it's actually working really well. I would tell you, I could tell you many other examples that Arlington does, and we try to do that. I mean, for instance, I would just tell you that whether we like it or not, I know sometimes some people don't even, because everybody think that everyone's heading a track for college. Sometimes there's a track for vocational education. You know, there are some more career centers where we need to find tracks so some of our students, for whatever the circumstance in life, can become welders, plumbers. You know how much a plumber makes these days? You know, when's the last time you needed a plumber or electrician in your house? You know, you make some serious money. So there are different tracks for the educational track. I will tell you this, on the behavioral health issue that you raise, we are not doing enough, neither in Virginia nor in the Washington Metro region. A lot of times, an ugly mass killing happens somewhere, and we all go through the same ritual of grieving and say how horrible it was, how terrible it is, and then we're going to do something about it, and then we don't do anything about it. And really is mental health issues need to be raised to a much higher level. We struggled in the Washington Metro region and to council government to talk about the issue among board of directors, among ourselves here, because no one wanted to touch the issue of gun control, you know, and things like that. So then our conversation ended up being about mental health issues and how we should focus in that regard. But I tell you, wherever you live, in the district, Maryland or Virginia, we have got to talk to your elected officials that we need to do more. And work in conjunction with the health provider. You are the experts. Many of you know how best to be more proactive in that regard. If there's anything that comes out of this conference today, you know, whether you speak English or not, and I just say this as an example, I was in a panel in Virginia, in Richmond, talking about human services, and in that content was the people who are incarcerated. So at one time when they opened up for questions, I raised my hand and I said, where are the mental health services for people who don't speak English? Now, I didn't say Spanish. I said for people who don't speak English. And they looked at me and they said, okay, next question. Because the answer was nothing. There's not even in people's radar. So if you cannot even provide some service to folks who may be struggling with some issues on mental health, we are exacerbating the situation. So we all collectively need to do better and directly focusing on treating and increasing resources for mental health issues.
The lunch bell is about to ring in a minute or two, but I want to highlight that these folks, health directors, come to the Council of Governments every month. We convene them, and their priorities are our priorities, so make sure that you know your respective health directors from the various jurisdictions across the region. One last question before we give these folks a round of applause. Walter, can you explain to us how we can get involved with Partido de Estrellas, and do you know any Estrellas, and what is that exactly?
All right, now we're talking serious stuff. I'm not sure why he brought it up, but making the context of exercising and fitness, DC United, our professional soccer team, our professional football team, is having a Hispanic Heritage Month event on Saturday, this Saturday between 1 and 3 p.m. I forget the name of the school.
Mary Reed, I will be there.
Mary's School. It's
Ward
at
1.
18th and California Street, and they have asked, they put together an all-star team. So I have been asked to be one of the players, and I'm going to treat this as my tryout for the starting lineup of DC United. So we encourage everyone to attend and join us. It's going to be fun. It's going to be music. It's going to be some prizes. It's going to be food, all kinds of good stuff. So come on down, cheer us on, or boo us, depending on what the point of view might be. Thank you.
So you can take the 92. You can take the 92. We're very accessible. You can bike ride, or you can walk there. But you can take the 92 bus, Woodley Park, and use Street Cardoso Metro Station.
Chuck, if I may take just 30 seconds to congratulate the Council of Government for this resource booklet here that really is really important. Thank you for putting this together. If you don't have one, make sure to get one.